bureaucracy to manage United States universal health care would be too big to work. Now, we didn't ask people to direct their questions to a specific individual, so panel, who would like to take first crack at that? Okay, Dr. Flowers.
It's actually quite the opposite. The bureaucracy that we have in this country to keep this situation that we have going is huge and actually wastes about $400 billion a year. So if you look at the growth of healthcare providers over like the last few decades, it's been about a steady 3% increase. And if you look at the growth in health insurance administrators, it's actually been 10 times that. So that's what, when you have people that are doing the marketing and designing the different products and then answering the phone calls to see who can get which policy and who can't, that's been a very, very wasteful thing. If we switch over to a universal system, we'll save about 25% of our healthcare dollars right up front by reducing that administration. And it's not hard to do because it can be done administered regionally. So it's very doable, and it will end up saving us quite a bit of money. I hope that answered your question.
Okay, next question. What's wrong with the Libertarians' proposal for a health savings account and regulated insurance plans? Yeah. All right, Dr. Flowers.
Anybody else? I do this every day. Talking about healthcare, either in public or meeting with legislators. Okay, so wait, remember the question again? It was the HSAs and the...
Right. What's wrong with the Libertarian proposal for health savings account and deregulated insurance plans?
Okay. Deregulated? Oh my gosh. Okay. Okay. First off, HSAs, health savings accounts, are operate under this what we call this consumer-directed model, which operates under the false premise that people actually can make the best health decisions when it comes to them paying directly out of pocket for their health care. And what we see is the complete opposite, is that when you have co-pays and deductibles, when people start getting sick, they actually decide to wait because it's going to cost them some money. They don't want to pay money, maybe they'll get better. So they wait, and a lot of times they end up waiting so long, they didn't realize that what they had was really something serious that they should have had checked, and then they end up getting much sicker, and it costs a lot more to care for them. Plus, we don't see people doing the preventive healthcare things that they need to be doing because they have to pay money out of pocket to go see the doctor. So the HSAs haven't worked. We've got lots of studies that show that when people have to pay co-pays, they don't make good decisions, and that when they don't have to pay co-pays, they end up being a lot healthier. And in terms of deregulated health insurance, I mean, that's pretty much what we have because, and Dr. Pierce is a great person to speak to about this because prior to her involvement with the single-payer movement, she worked for a number of years at the state medical society level trying to regulate health insurance companies and saw firsthand how every time you write a regulation, as quick as you're writing a legislation, they're writing a way to get around it. So, I mean, this was evidenced in Congress in the House, I think just a few weeks ago when the insurance companies said, yeah, we'll take everybody, but we're not going to stop the practice of rescission. Do you know what rescissions are? That, you buy an insurance policy, but then you get sick, they find a reason to drop you. And they said, there's these 1,400 reasons that we have, which include pregnancy, to drop you from your insurance policy, but we're not going to stop doing that. So if you allow for insurance companies to be deregulated, which is essentially what they are, they create huge profits for themselves by denying and restricting care, and people continue to die and go bankrupt and suffer. So we don't see that as a good solution.
Can I just make a comment on that? Bobby Scott used the term, he said that we do things better together as a group in healthcare. And I think these health savings accounts have individuals on their own doing their own thing. And one of the things that single payer would do, it would involve us all together to support the health care of all. And we would all pay a fair tax to defray the cost of providing care to people. And there would not be a question of coverage. There's this big conflict between care and coverage. And the conversations going on in Washington now is all about coverage. It's not about care, except insofar as they want to save money. But the thing is care, and And if we all do it together, we'll do it better.
Dr. Flowers, isn't a health savings account tied to being employed as well? So you still have the employer mandate. So if you should find yourself unemployed, and you don't have any money to go into your health savings account.
Well, it also assumes that you can save enough money to cover
Yep.
your health expenses, which works well if you don't get sick.
Exactly.
But what we're looking for is insurance for those who are unlucky. And, you know, it's like fire insurance for your house. Most people don't ever need it, but when you do, you can't cover the expense. That's why you have insurance. And if everybody's trying to save up for and you get tax benefits on these things, and the people that can afford to save in these tax deferred accounts are those who are healthy and wealthy. And so they're getting no tax benefit, and when they get sick, there's no insurance, unless it
runs out quickly.
would require you to get catastrophic coverage. But basically, you're on your own, getting a tax benefit, and if you get sick, there are very few people who can actually cover themselves for these things. And so it works well for the few wealthy people that can save up. For the other 98% of the public, it's useless. And the people that can take advantage of these are the people that have insurance anyway. So they are not presently a problem. And deregulation just allows insurance companies to cover you for everything except what you've got.
Next question.